Hi everybody, welcome to my channel. Today we're going to talk about separation anxiety. I'm Rita and today it's all about you. We say that the person has separation anxiety when she reveals to be really afraid when she's not with a certain person. And this can happen with one person, with several persons, or even with pets. This is also common not just in adults but also in children. A person can develop the extreme anxiety that is a result of a separation situation. And this can even include certain physical symptoms like headaches, nausea or sore throat. The separation anxiety as a disorder may usually start during childhood, particularly around 2 years old, because in this age the child doesn't understand that the person is nearby even if they cannot see them. And this can be something that can be with a person until adulthood, even start during childhood. Separation anxiety is very common and even natural for kids until 4 or 5 years old, but in adulthood is considered a disorder. For older children, this type of anxiety is associated with an extreme fear of being away from their parents or caregivers. This also can make a child less willing to participate in social events like summer camps, sleepovers, or just play with friends without their parents being around. For adults, it's very common that this type of anxiety starts when they are not around their children, spouse, family member, and all of type of responsibilities that we have during our daily life routines start to be very difficult to achieve. The main symptoms of separation anxiety may be extreme distress about anticipating being away from home, excessive worry about losing a loved one in an accident or in any other type of circumstance, a constant fear of all these feelings and these negative emotions that this type of separation may cause, not being comfortable being home alone, particularly with children and teenagers, refuse to sleep away, to travel or to do any type of activities that their loved ones will be not present, repeated nightmares about loss, about separation, about being away from home and from the people that they love, physical symptoms like headaches, stomach aches, tachycardia, sweating cold, and even chest pain. This type of disorder is intimately connected with panic attacks, panic disorders, general anxiety disorder, and in a child is very often we see cases of bedwetting, tantrums, and intense guilt or fear. For adults, the separation anxiety can come from a trauma, but for a child can be a result of a significant change in their life, like for instance change of environment, high experience stress situations, overprotective parents, insecure attachments, and even the lack of imprinting during the first days and weeks of the child's life. In adults, the risk factors are a pre-existence of OCD or any other type of mental health issue, usually much more often happens in females, that may eventually suffer from a traumatic experience or even abuse during childhood, or a connection with loss during childhood or during the early days of adulthood. To help a child to overcome separation anxiety, you have to be consistent, using always the same kind of rituals, particularly when you leave the child in some place, like in kindergarten with somebody else, with a caregiver, and so on. When you are still with the child, you have to give all your attention, but when you leave, don't turn away, say a quick goodbye and just go. A child needs a routine to feel safe, so it's important for her that you do the same every day. This helps build trust, and for that is also important that you keep your promises. Allow the child building confidence and independence. Explain and be very specific about the time that you are coming back, making some reference like I will come back after your nap, or I will come back after you do some kind of activity that you know that it's next of your picking up. Practice being apart. Let the child stay with some family members like grandparents, for instance, during short periods of time, but also do the same kind of rituals. This is very healthy for you as a parent, but also and mainly for your child, because she will get used to be with other people, she gets used to be social without your presence. As an adult, and if you are diagnosed with separation anxiety, maybe you will need to have some types of anti-anxiety medication, along with some sessions of talk therapy. But this is also important that for all of this you will look for your mental health provider and talk about all of these things, all of your symptoms and things that you feel when you are apart from the ones you love. And so that's all for today, guys. I hope you like it. I hope you subscribe to the channel. Leave a thumbs up, share with a friend, comment if you want, and I'll see you next time for another video. Bye!